The committee will come back to order. First off, we're going to call Rep. Glanville with the Van Andel Institute. Thank you for being patient and
Good to go? Go ahead. Okay. All right. Good afternoon, Chair Jenkins-Arno and members of the committee. I'm Steve Martin. I'm Representative Glanville's Legislative Director. Thank you for having us here today to provide testimony for the continued support of the Van Andel Institute located in Grand Rapids. The Van Andel Institute was founded 30 years ago and has since become a cornerstone of the medical mile in Grand Rapids, seeding a vibrant life sciences community and serving as an economic engine that brings talent and investment to West Michigan. Over the past decade, the state of Michigan has been a proud partner in advancing the Institute's foundational research, work that underpins the development of new treatments and potential cures. This partnership has helped draw top-tier talent to the region and solidify the Van Andel Institute as a cornerstone of Grand Rapids' medical mile. These state funds have a multiplier effect. They help the Van Andel Institute recruit new faculty and enhance research infrastructure, which in turn allows them to secure additional external funding. Through cutting-edge biomedical research, inspired scientific education, and relentless commitment, the Van Andel Institute is designing innovations that will improve health and enhance lives for generations to come. My boss is proud to recognize the value of the Van Andel Institute and our ongoing support of their truly incredible work with this $1.5 million investment. With me today to share more about the work of the Van Andel Institute is President and Chief Scientific Officer, Dr. Jonathan Licht. He's an internationally recognized physician scientist who studies blood and other cancers in the pursuit of innovative therapies. Dr. Licht joined the Institute in February of this year, succeeding Dr. Peter Jones, who has returned to the lab full-time after 12 years of exceptional leadership, vision, and dedicated service. Dr. Licht is an internationally recognized physician scientist and medical oncologist whose work focuses on understanding and treating blood and other cancers in the pursuit of innovative therapies. As an expert in epigenetics, Dr. Licht's research explores how problems with the instructions for gene regulation contribute to the onset and progression of cancer. Dr. Licht has held numerous leadership roles in national cancer research organizations and scientific journals, and in 2023 led the University of Florida Health Cancer Institute to become a National Cancer Institute designated cancer center. He is an elected member of the American Society of Clinical Investigation and the Association of American Physicians, and an elected fellow of the American Association for the Advancement of Science. Dr. Licht has held key leadership roles in major national scientific organizations and served on editorial boards for several prestigious journals. His professional recognitions include numerous mentoring awards and election to the American Society for Clinical Investigation, the Association of American Physicians, and as a fellow of the American Association for the Advancement of Science. Today, he brings that expertise and leadership to the Van Andel Institute, where he is helping drive innovative biomedical research and train the next generation of scientists. Please join me in welcoming Dr. Jonathan Licht. Thank you.
thank you
Thank
for
you
being
very
here.
much, Mark, and many thanks to Representative Glanville for sponsoring us to meet with you today. Thanks very much. It's a pleasure to highlight the Van Andel Institute's work and share how the state of Michigan's long-standing support enables life-changing discoveries in economic growth in West Michigan and beyond. As you heard, the VAI is an independent nonprofit institute focused on research and education, founded 30 years ago by the Van Andel family. What began as a vision to bring world-class science to Grand Rapids has grown into a truly remarkable institution, and this is what attracted me to come here after serving many other places. We're home to 40 laboratories and 600 dedicated employees, and we're a significant engine for innovation, contributing to the growth of the medical mile, an area that's seen more than $2 billion of research and healthcare infrastructure and investment since ground broke on this institute in 1998. Today, as you heard, the VAI is a world leader in cancer epigenetics. This is the study of how genes are turned on and off in cancer, neurodegeneration, metabolic disease, how this happens normally, and what goes wrong to cause these diseases. And most importantly, what can we do to fix things and make things right? In addition, the Institute has robust research in Parkinson's disease, Alzheimer's, and amyotrophic lateral sclerosis, as well as other rare disorders. We believe collaboration is essential to accelerate progress. That's why we're home to a Stand Up to Cancer Dream Team on epigenetics that brings together medical professionals, healthcare professionals, researchers, and industry to move promising therapies into clinical trials. Additionally, alongside Cure Parkinson's organization, we spearhead the International Link Clinical Trials Program, which takes currently approved drugs but never used for Parkinson's disease and repurposes them to trials to slow or stop Parkinson's disease. The Institute has supported 25 clinical trials and human subject-related projects over the past decade. The impact of our work is increasingly recognized on a national global scale. In 2025, the Nature Index, which measures institutional scientific output, ranked VAI as number 5 among North American nonprofit organizations in biomedical sciences. The ranking represents a significant upward trajectory, and globally we stand at number 17. This measures VAI's growing impact, propelled in part with your generous state support and strategic investment. Since the 2015, the state of Michigan's been a vital partner in our mission through annual allocations. And of course, state funding has an important multiplier effect. It helps us secure highly competitive federal grants, recruit and employ more highly skilled faculty, staff, and other experts, and increasing our economic impact and important impact on the knowledge economy. Nationally, we know that every dollar invested by the NIH and other sources leads to $2.57 of economic activity. So not only are we learning more to set up the next generation of cures and treatments, we're expanding the economic activities of this region.
Thank you.
VAI's annual revenues from grants and contracts increased from $8.5 million in 2013 to $33 million now, a reflection of the increasing impact of our science. State support has been crucial in recruiting 19 new investigators to the VAI, securing new jobs, investments, and discoveries in areas such as cancer, Parkinson, and others. Let me just say a few examples of this.
Well, we have to, if you don't mind, just kind of coming to a conclusion fairly quickly. We've got several other projects we have to hear from today as well. So, and we have questions, I believe, from some members. So if you don't mind, just.
Of course. Thank you. Thank you for the
thank
opportunity.
You. Oh, if you just wanted to finish up, you could. Okay. Any questions? Rep. Robinson.
Thank you, Madam Chair. Thank you for your presentation. It says you've been doing this for could you talk about some of the advancements you've made as far as cancer research? Because it seems like it's just becoming more and more common. What kind of success are you guys having in your research?
We can't hear you. You're muted.
Yeah, thank you. Thank you. So let me give you some specific examples. For example, we're working with local clinical programs in West Michigan to develop a new blood test for pancreatic cancer. Dr. Hobb has been monitoring various molecules in the circulation to see if there's an early test for pancreatic cancer, which is such a horribly lethal disease. This is undergoing clinical validation, and we're hoping that it will work its way to the clinic. Additionally, we're found that very importantly now, we understand that the immune system is quite critical for cancer prevention, for cancer treatment, and we're stimulating it with various immune therapies. And we now understand that there's nutrients and metabolism in the cells that can affect how well the immune system works. So Dr. Jones is studying how different nutrients can actually fuel cancer or slow cancer, in part by affecting the immune system. Additionally, the Stand Up to Cancer team has been performing clinical studies using combinations of drugs that we validate initially in the laboratory and then pushing it into patients. One example is a clinical study of adding vitamin C to modulate the effects of these epigenetic drugs. As we know, vitamin C is actual essential factor for some of the gene controlling machinery of our cells. Those are a couple of examples I have for you.
Thank you, Madam Chair.
Thank you. So I just had a question regarding where the funding goes. Is it just general into the research, or does it go specifically to scientists or specific types of research, or is it just go into the pot and help the institute overall?
We've used this for very specific reasons. I could say the past 2 years, we have a set of scientists here who study neurodegeneration. And to understand this in great detail, we need to look atom by atom at the fine structures of neurons. And this is using a new type of instrument called a cryo-electron microscope. It uses very heavily cooled samples and uses beams of highly focused electrons to image and exactly understand the structure of normal neurons and the components that go astray with things such as Alzheimer's or neurodegeneration. These instruments are very costly, and this funding has helped us secure one of only 8 such instruments in the United States. And this in turn allowed us to recruit 2 rising stars who have very prestigious early investigator grants on studying these neurodegenerative diseases. So we've used this in a focused way to get the most leading edge type of equipment and get the most cutting edge scientists here to West Michigan.
All right. Well, thank you very much. We really appreciate you being here today. Thank you for your patience with our timing as well. So thank you.
You're very welcome. I'm sorry, some was unclear. Did you have another question?
No other questions. I just wanted to say thank you for your patience today as we were working through a long session.
Of course. Thank you so much for this opportunity. I look forward to meeting some of you in person in the future.
All right. Looking forward to it. Thank you.
Thank you.
All right. Next up, we have Rep. Vanderwall with Communities Overcoming Violent Encounters.
Thank you, Madam Chair, and members of the committee. I appreciate the opportunity to be here today. As you know, I am Rep. Vanderwall, and I am honored to be here today to speak on behalf of a critical initiative serving northern Michigan. I am requesting $500,000 in one-time funding to support Communities Overcoming Violent Encounters, or COVE, and their 10-year building campaign. COVE is the only comprehensive emergency shelter and advocacy program for survivors of intimate partner violence and sexual assault across Mason, Lake, Oceana, and Manistee counties. Every day, individuals and their families turn to COVE in moments of crisis. Their services include 24/7 crisis helpline, emergency shelter, sexual assault forensic exams, safety planning, legal and medical advocacy, and prevention education. The shelter itself is central to COVE's mission, but it is aging and in urgent need of repairs and upgrades to remain secure, accessible, and trauma-informed. Through their 10-year building campaign, COVE is completing phased improvements to address critical infrastructure needs, enhance safety and security measures, accessibility, upgrades, HVAC replacement, and expanded living and support spaces for survivors and their children. These improvements are essential to giving survivors a safe and supportive place to heal and rebuild their lives. Investing in COVE is an investment in safety, stability, and the future families across northern Michigan. I strongly urge your support for this funding, and I thank you for the opportunity to testify today, and I'm happy to answer any questions on this critical project.
Thank you very much. Do we have any questions? Okay. I was just curious as to how this is a 10-year building plan. Where are we in the 10 years?
Well, yeah, actually, I believe this is probably their 10th year, and now the building, of course, is starting to age a little bit, and we're trying to, we're self-sufficient in most cases. We raise all our monies through grants, donations, and et cetera. And of course, everybody knows the cost of what it is, but the building is maxed out, and we really need to build some more living supply spaces so that we can house more people, and that's really what it's coming down to, is that the facility is being used more than what we expected it to be, which is a good thing and a bad thing and the same thing. I'm glad that the program is there to help, but we also need to invest in, and our monies are tight.
Okay, so you're just expanding the building what you're currently in, and then so this 500,000 kind of takes you to the end of your 10-year project,
Right.
and you'll be finished with
Yep.
that. Okay, great. Okay, I think that's all the questions we have today. Well, thank
All
you
right,
so
well,
much.
thank you very much.
Appreciate
I
it.
appreciate it.
Thank you for being here and waiting so long. Well, I guess you didn't have a choice, did you? Next up, we have Rep. Schmaltz with Phoenix Mobility Rising Catch a Ride Network. Go ahead whenever you're ready.
Thank you, Madam Chair and Committee. Many of our veterans face transportation issues, especially trying to get to their health care appointments. We're requesting $979,000 for Phoenix Mobility Rising to expand the Catch a Ride network. This will provide transportation for veterans to access medical and behavioral health care services across the region. Many of our veterans miss critical appointments because they can't find transportation, leading to worsened health care outcomes and increased emergency care costs. The Catch a Ride program coordinates rides through local providers, making sure our veterans get to their appointments to get the health care they need. CEO and founder Valerie Leffler joins me today to talk more about this. Valerie?
Thank you so much, Chair and representatives, for the opportunity to be here today. I want to begin with a story of one of the 2,000 veterans that we have had the honor and privilege to serve here in Michigan. He is a 78-year-old Purple Heart recipient from the Vietnam War who can no longer drive because of severe vision impairment. His daughter, Renee, shared with us that the transportation that he received through the Catch a Ride network has been life-changing. It allowed him to reach specialty medical care at the VA that was previously out of reach. And just as importantly, it enabled him to access local community-based resources for veterans that he could connect with and build community. For a veteran who has sacrificed and served our country and now faces the challenges of aging and disability, that independence isn't a luxury, it's dignity. And we hear daily from families across Michigan at these same barriers. One caregiver, Shirley Riley, wrote to us, and she shared that she is legally blind, but her husband is a disabled veteran who needs to go to Ann Arbor on a regular basis to see his doctors. One recent post-surgery trip from an eye care appointment cost them half of the money that they normally spend on groceries. Without transportation, families like Shirley's are forced to make impossible choices between food, healthcare, and daily needs. My name is Valerie Leffler, as Kathy said, founder of the Catch a Ride Network. For the past 7 years, we have been working in 8 different Michigan counties, helping veterans overcome these barriers. And the need across Michigan is tremendous. More than 153,000 veterans here in the state of Michigan live with a disability. And just as importantly, 5,300 veterans live in low-income households without access to a vehicle. And even with a vehicle that does exist, many veterans can also not drive due to vision loss, chronic pain, or severe health-related reasons. And we know that research shows from hundreds of studies, when transportation barriers are removed, veterans keep their mental health care appointments. There's fewer emergency room visits, and people receive care earlier. They're able to receive, an inpatient visit versus being hospitalized. And what makes the Catch a Ride Network different is that we're not creating a new transportation program. We're coordinating the resources that Michigan has already invested in the public transit agencies within small businesses, volunteer driver programs, and specialized services. So case managers, and through our technology that was in part put to here in the state of Michigan thanks to the Department of Transportation, that these partners all together operate as an ecosystem. So it's not adding another vendor to the ecosystem, it's leveraging these existing organizations in a more efficient way. And it strengthens the local transportation ecosystem. So the request before us today is to support transportation for veterans in Lenawee, Hillsdale, Jackson, Calhoun, and Kalamazoo counties, demonstrating the model can be replicated across Michigan. That represents about 50,000 veterans within that service area. And at the heart, this proposal really reflects a simple commitment. Michigan already invests in health care for its veterans. This program ensures they can actually reach it, because the men and women who answered the call to serve our country should never have their care determined whether they have a ride or not. So I thank you so much for your time and the opportunity to share today, and I'm happy to answer any questions.
Thank you so much for being here today. Questions, Rep. Robinson?
Thank you, Madam Chair, and thank you for your presentation. I have a couple of questions. First off, how many veterans do you provide rides for every year?
It varies based upon each year, but last year in the state of Michigan, around 2,000.
And I noticed that you cover, 5 different counties right now?
Currently, yeah, Wayne, Washtenaw, Jackson, Hillsdale, Lenawee, we have some limited service, and then we're expanding into Oakland County this year.
Do you know if there's another organization like yours that provides this service?
There is no other organization like ours literally in the world. We have the Ministry of Japan and organizations in Australia reaching out to have this kind of ecosystem approach deployed. So it's really unique in how we're basically taking existing options and putting them, they call it mobility as a service, kind of like Kayak or Hotwire for flights, only for local transportation options. And what we can do is put funding on a mobility wallet. And what that does is that enables that veteran, when they need that doctor appointment, they can just draw down on that wallet or that EBT card of transportation, if you will, and schedule that appointment. And they decide that day, based upon their health, do I feel like I'm up to riding the bus, or do I need a taxi, or do I need a wheelchair accessible option? So it's a very person-centered model based upon how their care is and what level of service they need.
And one last question, if I may, Madam Chair. What is the most common reason given on why these veterans can't get to the facility for their health care?
One of the biggest reasons is cost, and that the VA does not provide transportation for veterans who do not have a service-connected disability. So in the United States, the VA prohibits transportation unless you have a service-connected disability, and roughly 3 out of the 4 veterans that we serve do not have service-connected disabilities. And many times the service-connected disability options that are provided through the DAV and the volunteer programs operate a very limited service. So for example, in Lenawee County, you have to get on a bus at 6 in the morning to get to Ann Arbor, and then you won't get home till 4 o'clock that afternoon. And if you're going through cancer treatment or certain things, that is a long day, and that's a huge commitment. In addition, many times your spouse or significant other cannot go with you unless you have a doctor's note. So if I'm going to, let's say I got some test results and I need to go get them read to me by the doctor, my significant other cannot ride with me. We see that very heavily, gentlemen who are getting and female veterans being told you have cancer and they do not have their significant other there at that time. So part of it is the limited ecosystem that is available. Part of it is the cost of transportation. So for example, in order to get from, let's say, Adrian to Ann Arbor, you're looking at around $300 round trip. And so that's cost prohibitive.
Thank you, and thank you for what you do. Thank you, Madam Chair.
Thank you, my pleasure.
I have a dad. My dad's in Lenawee County. That's where I'm from, and that's the reason why he doesn't use the VA transportation, because it takes too long. It's too long of a day. He doesn't want to be gone that long. So, anyway, can you help me understand the $979,000? Is that creating an app, or
No,
what
the app and the
specifically will that be?
technology already exists. So
Okay.
it really is, majority of that funding is going for paying for the rides to the transit agencies, to the local taxi services, Uber, volunteer driver networks. It's also going to pay for kind of the call center. So we operate a 7-day-a-week call center that supports these rides. So a lot of folks they might want to use the mobility wallet, but they're not app users. They need to call and say, hey, book me that ride, and we can send the trip, and they still have the wallet. So it provides kind of also, hey, I can't find my Uber. It was supposed to be here. Can you send a new one? Or, hey, I see a new transportation option. I've never heard of LBU Taxi. Can you tell me, are they a good vendor or not? Like, so we can provide that guidance and that counseling and support as part of it. We also have case managers that are kind of like the care coordinators of transportation. If you've had, any chronic illness lately, there's a person that the healthcare system puts in place to help you coordinate. My husband recently had a brain tumor, and they were like, first you go to this therapy, and then you go to this therapy, and then you see this specialist, this specialist, this specialist. We realize that in transportation, it is so complicated for some folks' healthcare journey, they need that wraparound support. And so that funding goes to pay for directly the rides, the call center that folks are also connecting with, and then those case management support needs for, a veteran who's all of a sudden, he's got 57 appointments he's got to get to, and he doesn't have a significant other to help him. So a number of the veterans that we serve do not have a support partner to help them navigate, and so we're really kind of filling that gap.
Okay. And then how would you sustain the program if once you got this, if you were to get the 979, how would you keep raising funds, or how would you do that in order to keep that going?
Yeah, through a variety of different approaches. So the transportation partners that are part of this can increase their ask to the State Department of Transportation when the model is shown proven for that. So for example, Key Opportunities is a transportation provider in that area. And if she's able to show this worked and we're able to serve these veterans, when she makes the ask to the Michigan Department of Transportation for her next cycle's budget, that can be included. In addition, we're actively fundraising. Ford Philanthropy invests $1 million every year in the Catch a Ride network. And right now we can leverage those dollars with the matching funds that the state needs for those federal dollars that flow through. So we really take a lot of effort and time to make sure that we're diversifying the funding, and this is really the kickstart that we need to provide the data, the impact, and build out some of the integrations between the new transportation providers in Kalamazoo and Calhoun counties within the technology, because they weren't previously a part of the pilot program that we were able to show that this works.
Okay. Well, thank you very much. Appreciate you
you.
being here today.
My pleasure. Thank you for the opportunity.
Uh-huh. Next up, we have Rep. Schmaltz with Habitat for Humanity Jackson. Go ahead whenever you're ready.
Okay, thank you, Madam Chair and Committee. This request has to do with housing and helping our vulnerable people with home ownership. We're requesting $1.5 million for Greater Jackson Habitat for Humanity in partnership with the Welcome Home organization to support the construction of new homes and cooperative housing. This will expand access to affordable home ownership for low to moderate income families, including essential workers, while stabilizing neighborhoods and strengthening the local workforce. By combining public investment with private support and volunteer labor, this project delivers long-term economic and social benefits while increasing housing stability across Jackson County. Executive Director of the Welcome Home Organization, Victoria Jemerson Overmeyer, joins me today to talk more about the program.
Thank you for having me, Madam Chairperson and Committee. I'm Victoria Jemerson, representing the Welcome Home Organization in Jackson County, as well as Habitat for Humanity. Investing in funds in Greater Jackson Habitat for Humanity's 20 by 28 program and initiative is a responsible and strategic use of taxpayer resources that directly address the growing shortage of affordable housing in Jackson County. This initiative will create homeownership opportunities for working families who are increasingly priced out of the housing market, while strengthening neighborhoods and supporting local economic growth. Habitat leverages public funding and significant private donations, volunteer labor, and homeowner sweat equity, ensuring that every public dollar invested produces a greater community impact. As a part of this broader effort, Habitat for Humanity, Jackson, Welcome Home Organization, and the City of Jackson have formed a really powerful partnership. In addition to the 20 by 28 plan that Habitat for Humanity is doing, the Welcome Home Organization submitted a RFP and has been awarded to build 4 cooperative houses for transitional and cooperative living spaces in the Flatiron District of Jackson. These homes will serve youth transitioning out of foster care, veteran families in need of stable housing, as well as families that will be transitioning out of our local interfaith shelter as well. These are groups that are disproportionately affected by the housing insecurity. The homes will function as intentional stepping stones for individuals and families moving forward from the Jackson Interfaith Shelter, Altering Outcomes, and My Place, as well as other community partnerships, creating a continuum of care that supports long-term stability. This collaborative model brings together multiple Jackson community partners to provide holistic wraparound services and support, including workforce development, life skills training, mental health resources, and community integration. By aligning housing with supportive services, this initiative directly combats homelessness, reduces recidivism and into crisis systems, and builds pathways towards independence. The homes built through this program provide long-term stability, improve health and educational outcomes, and help families build equity as well as generational wealth. In addition, new houses increases the property values, expand the local tax base, and stimulates the economic activity through construction and local spending. By supporting the 20 by 28 home initiative, as well as the cooperative transitional housing partnership with the Welcome Home Organization, public investment will help create stronger families, healthier neighborhoods, and a more stable and prosperous Jackson.
Thank you very much. Any questions? Rep. Robinson?
Thank you, Madam Chair. Thank you for presentation. So what will the $1.5 million go to specifically if you're appropriated these funds?
Yep, so 1.1 will go to Habitat for Humanity's 20 by 28 plan to build those homes. They are in partnership with private donations as well as the City of Jackson in obtaining those funds. And then approximately $450,000 will come to the Welcome Home Organization. The City of Jackson awarded us the RFP for these 4 homes, which equates to approximately $560,000. So each house to build is about $195,000. And so they're giving us $140,000 per home, so we need to pay for that gap funding in getting the houses and the equipment, the washer dryers, the refrigerators. So that $450,000 will meet that gap funding that we need to build the 4 cooperative and transitional houses.
Thank you. Thank you, Madam Chair.
Okay, I think that answered my question as well. Go ahead, Rep.
Thank you. No, I was just going to say, these 2 organizations, Welcome Home and Habitat, work really good collaborating with our interfaith shelter, which is the homeless shelter, My Place, which houses foster care kids who age out of the system. So it's a real great effort between a lot of different groups to make sure that housing is there for our vulnerable people.
Yep.
Great. Thank you very much. Appreciate you coming in today.
Thank you.
Yeah. All right, next up we have Rep. Pavlov with Recovery Community Organizations. Go ahead whenever.
Thank you, Madam Chair. I'm Ben from Representative Pavlov's office, and today I'm joined by Patrick Patterson, who is the president of the Michigan Association of Recovery Community Organizations, as well as the executive director of Blue Water Recovery and Outreach Center. And I'm also joined by his lovely mother, Cindy. I'm going to hand this over to Patrick to tell you about why their work's important.
Thank you, Ben. Madam Chair and members of the committee, thank you for the opportunity to be here today. My name is Patrick Patterson. I proudly serve as the Executive Director of BW ROC, the Blue Water Recovery and Outreach Center, President of MARCO, the Michigan Association of Recovery Community Organizations, and Vice Chair of the Michigan Opioid Advisory Commission. For clarity, I am representing MARCO and a member of Lived Experience today, which means I am a better father today. I'm getting married in June, and overall a better human being as a result of recovery from addiction. We respectfully ask for your support of continued funding for recovery community organizations through Section 978 and opioid settlement funds as outlined in our proposal. At its core, this request is about one thing: helping people not just get into recovery from alcohol and drug addiction, but stay in recovery. Treatment is critical, but we know something else is important. Treatment alone is not enough. People leave treatment and still need housing, employment, transportation, community, and someone to walk alongside them. That's where recovery community organizations come in. RCOs are peer-led organizations, meaning the people doing the work have lived experience. We serve people before treatment, during treatment, and long after treatment ends. We are grassroots, community-based organizations led and governed by people in long-term recovery from substance use disorder. Our work focuses on sustaining recovery and preventing relapse. And there are a little over 20 to 25 RCOs across Michigan. This morning, I met a gentleman for the first time who was a manager at a local paint store. He has worked there for a little over 25 years, and 30 days ago, he surrendered his life to sobriety. I asked, "How did you hear about us?" And he said he needed community, and he didn't have Medicaid. See, he wasn't on Medicaid. RCOs take all people, but it's important to know that we are not Medicaid providers, which is why we're here asking for additional support. After World War II, the U.S. created the VFW Hall, a therapeutic way for war vets to get together and share their war stories. Over time, it became a healing agent, and VFW halls popped up in every city across the U.S. Today, we are in recovery from a war on addiction, and the RCO is the modern-day version of the VFW hall. Through our recovery coaching, support groups, and consistent connection, the gentleman from this morning has stayed engaged, and today he gets to work on his long-term recovery from support from an RCO. This kind of transformation doesn't happen in a treatment facility alone. It happens in the community. When people have long-term recovery support, they are more likely to stay sober, stay employed, stay housed, and avoid returning to a higher cost system. This funding provides direct support to local organizations and builds statewide infrastructure to ensure sustainability and effectiveness. This is not duplicate of treatment funding, it's complementary. Treatment helps people start recovery, RCOs help people sustain it. So today, our ask is simple. Please support $1.2 million for Section 978, $12 million for recovery community organizations from opioid settlement dollars, and $250,000 to an association made up of RCOs to help with technical support, certifying RCOs, and reporting to you the results of this investment. Let me restate, the $12 million is from opioid settlement funds. It does not add to the state budget, and it's critical that this language states it's to recovery community organizations, not just recovery. Let me end with, every person in recovery represents a life restored, a family reunited, and a stronger community. Thank you for your time and your leadership. I'm happy to turn it over to Cindy Hummel. It was not planned on her being here, but on my way up, we needed somebody with real life lived experience, and I thought a mother's perspective might be impactful. So about 5 minutes before I left, I called her and seen what she was doing, and she was making hamburgers for our family dinner at our recovery center on Monday. So I'm gonna turn it over to Cindy.
Real quickly, if you don't mind.
Yeah.
Okay. I'm Pat's mom. I didn't have anywhere to take Pat when he got addicted. So they had a church in Richmond, Michigan that would help with the people with addiction, except they were full. And so he had to detox on my couch. And by the time we got in there, because he detoxed on my couch, they cut his recovery time in half that he could be at the hospital. I thank God for B-Rock. B-Rock is there for so many families. You lose your family too, and this place, you know, your family is welcome, and they help with you in recovery. They do dinners, which I'm a part of every night, so the family can stay together instead of being separated. So I'm just, I guess, I know it works. And I wish my other son had this so he didn't have to kill himself.
Gosh, I'm sorry about your loss. Thank you for being here. And do we have any questions? Yep, Rep and Workham.
Can you restate, you want 12 million from the opioid settlement funds? What was the other million? And
250,000 from opioid settlement funds to an association made up of RCOs that can help sort of provide certification and technical support, and then 1.2 million from state dollars out of Section 978. That's usually an annual continuum.
okay,
That would be Michigan Mental Health Code 273B.
okay. With the opioid settlement, are you looking for ongoing at 12 million a year? And is that 250 a one-time, or is that something that's continuous? What's the 250 for?
Ongoing, yep. We've got to get an association up and running that helps with the areas that these little grassroots organizations don't have and can't provide, which is certification. One, we need to ensure that the funding goes to real RCOs. Now that they're providing funding, you're having treatment or just anybody can sort of make yourself look like an RCO on paper, correct? So we had, 76 people apply for the grant this last year? So it's important that the language is stated that it's to recovery community organizations, and House Bill 5302 is to help make that become certified RCO. So in order to receive funding, you have to be certified. Marco will provide that certification. No better person to know what an RCO is than the RCOs themselves, because it's starting to produce a lot of, we had a lot of applications this last year, and just over 20 were awarded with over 70 applying. So in order to sort of put some controls on this, provide reporting to our legislators every year, so House Bill 5302 will also ensure that a report is produced to our legislators on the results of this investment, but it helps us sustain ourselves. And because it's from opioid settlement, it will be ongoing. To answer your question, I think we're in year 4. We're anticipated 18 years of this, so we do understand that it is opioid settlement dollars that is helping with the sustainability at this point.
Is the intent of the 250,000 then to go to narco?
Marco, yes.
Marco?
Mhm. Yeah,
Got it.
yeah.
Thank you.
Yep. You're welcome. Yep.
Okay, I think that's our questions for today. Thank you so much for coming in today. Appreciate it.
You're welcome.
All right, next up, we have Rep. Deboer with Holland Hospital. Dressing up the place, I see. Thanks for your patience, too. Okay, go ahead whenever you're ready. You want to turn on your mic? I don't know if it's on.
Thank you.
There you go.
I'm State Rep Nancy Deboer for the 86th District, which is the Holland area. So Chair Jenkins Arno and committee members, thank you for inviting me to testify today on behalf of this important project for the greater Holland area. Holland Hospital is an independent community hospital based in Holland, Michigan. I'm requesting a $1.7 million grant to support a one-time project there. The project is a new procedure room for their endoscopy department. Funds would complete construction and purchase the required equipment and technology to perform advanced endoscopy procedures. Holland Hospital is prepared to invest in the ongoing staffing and operational costs for this service expansion. Holland Hospital is a nonprofit hospital also. I'm joined today by Mark Pollock, President of Holland Hospital, and Joe Bonello, who is the Vice President and Chief Clinical Officer, who can speak more about this project and its many benefits to the hospital and the local community. Thank you guys so much for coming on and for waiting. Appreciate it.
We appreciate it very much too, Nancy. Thank you very much. And our thanks to Madam Chair and the committee for allowing us the opportunity to present this request. Just to highlight a couple of things that the representative already indicated, Holland Hospital sits on the shore of Lake Michigan, and we serve Ottawa and Allegan counties, but we see patients from the surrounding region as well. We're a 200-bed hospital with a 100-year history of independence, and we are one of the larger, in fact, I think we are the largest healthcare employer in Ottawa County and the third largest employer overall in the county, with over 2,500 employees and volunteers. Being an independent hospital, it gives us the opportunity to be very responsive to the needs of our community and to design programming that is designed to allow patients to remain in the community for the care that they need, which has pushed us to continue to advance the offerings that we have. And while we have for a long time had a very robust general endoscopy program, Joe is going to talk a little bit about the benefits of a advanced endoscopy service that we wish to implement with support from the state. I will just say also that not only does this program help us enhance care for the patients in our local area, but it provides an additional resource for the region for services and procedures that are actually quite difficult to get into, and there is a need for additional procedure space, not just in Ottawa and Allegan County, but the surrounding region as well. So I'll introduce again Joe Bonello, who is our Chief Clinical Officer, to provide you with some details on this capital request. Thanks. Go ahead, Joe.
Great. Thanks, Mark, and thank you, Chair Jenkins-Arno, as well as the rest of the community for giving us some time today. I think before talking about advanced endoscopy, it helps to have an understanding of what general endoscopy is. So I'll just give a real brief overview of that. Basically, general endoscopy is where we take a thin tube or a scope with a camera on the end of it and pass it either down through your throat to be able to look at your stomach or your small intestines, or we can go the other direction up from the bottom with a different scope, I should point out, in order to be able to look at the large intestine and other structures. General endoscopy, a colonoscopy is the thing that most people are familiar with. That is certainly the most common procedure that we do in general endoscopy. And general endoscopy is primarily used for screening and diagnosis. It's a tool to identify disease process. So in contrast to that, advanced endoscopy, which is what we're here to talk about today, is used for the treatment of the diseases. So things that are identified with general endoscopy, we can then go on and treat using advanced endoscopy techniques. The real advantage of it is that using advanced endoscopy is minimally invasive, so it avoids surgery. So things that otherwise would require a full surgical operation, we can treat with advanced endoscopy. And what that means is that it's fewer complications for patients. It's a much simpler procedure from the patient's perspective. It's a faster recovery. It's a shorter hospital stay. A lot of these procedures are done as outpatients and not requiring any hospital stay. Some require just an overnight stay, which is still a much shorter hospitalization than would be required with surgery. And then lastly, it's because of those other things that I mentioned, it's considerably less expensive. So it decreases cost for the patient. It also decreases the overall cost for the healthcare system. So for all those reasons, we are really looking to add advanced endoscopy into the services that we provide. So our ask specifically is for help with creating the infrastructure to be able to do that. We currently operate out of 3 procedure rooms in our endoscopy suite. When we built that endoscopy suite, we created shell space for a 4th endoscopy room. So we have the space available to do another room, but it is currently just shell space. And so it would require construction as well as all of the equipment to be able to bring it up to the space that it would need to be in order to provide advanced endoscopy. So that's really what we're asking for today. Specifically, the reasons why we want to do that, Mark already alluded to the fact that we really, it's a core part of our mission to provide access to care, local access to care for our community. We send currently about 600 patients a year that we transfer out of Holland into the Grand Rapids area for those procedures. So that's it's an inconvenience for the patient and for the family. It's difficult for people who have transportation issues. There's just advantages to be able to have procedures done closer to home. So we're really looking to provide access to care for our community. We're also looking to decrease the overall cost of healthcare. I mentioned the decreased cost to the patient and overall cost to the system. Another key participant in the cost of healthcare these days is employers. And in the last couple of years, we really have been working directly with our local employers to help them decrease the burden of healthcare on their companies. And this provides an opportunity where their employees can stay local, and it decreases the cost of care for the employers in our region. We see that as a double win. It's great for the employers. That allows them, if they can provide good benefits to their employees, it allows them to more easily recruit employees into our area. And as our area continues to grow, that's good for everybody. It's good for the economy of the county, which is all good for us as Holland Hospital. So
Okay.
those are two reasons. And lastly, the third reason why we want to do this is we see it as a good business opportunity for us. As Representative Deboer mentioned, we're a nonprofit hospital, but we still have to make enough money to keep the lights on, and endoscopy is one of the procedures that can help us do that. The demand for this procedure far outweighs what the capacity in our region is. As Mark alluded to, we have providers from outside of our region calling us, asking if there's opportunity for them to send advanced endoscopists here to do procedures because they have people who can do it, but they don't have the space to do it in. And so for us to be able to provide that access to the broader community creates a business opportunity for us that can help us to continue to remain to be a strong independent hospital and serve our community for another 100 years.
Okay,
So
thank you
with that,
very
I will
much.
again say thank you for the time and open it up to any questions that anybody
Thank you
has.
so much. Rep. Robinson.
Thank you, Madam Chair. Thank you, Representative DeBoer, and thank you for your presentation. Just a couple questions. First off, how many patients does your hospital see every year? Ballpark?
Go ahead, Mark. Do you have that off the top of your head?
I think we would probably compare notes on this, but I say our inpatient discharges is in the 4,000s area. When you count outpatients, that quadruples into the 20 to 30,000, and that's total patient encounters that come in and out of the hospital. That doesn't count all the medical practice visits and other types of procedures like laboratory tests and radiology images. When you start adding all that up, it's hundreds of thousands of encounters per year.
I can speak for endoscopy specifically. We're anticipating about 4,000 procedures in this coming year.
And my second question is kind of a two-part of the first question. I'm sorry, Madam Chair. First off, you mentioned in your ask that this appropriation, if funded, would expand the workforce. So by how many? And then my second part of that question is, how would that be sustainable for those new employees?
Sure. So adding a fourth endoscopy suite would probably add in the 6 to 8 employees area for the number of nurses and support staff that we need. We also are expanding the number of GI physicians that we have on our team, again, to meet the growing demand. A big driver of the demand is that about 4 or 5 years ago, the recommendations for colonoscopies was changed. It used to be that age 50 was the recommendation for colonoscopy, and they decreased that to 45. And so that added tens of thousands of people in our community who now fall into that criteria for scopes. And so the volume has been expanding, adding this fourth room. It won't quite be a 25% increase in staff, but it would be a significant increase in staff for us.
And I would add to that point that, Holland Hospital over its more recent history, I'd call it the last 20 years, has evolved from being an employer in the 1,500 range to an employer of the 2,500 and up range because of addition of services like this, which have kind of a momentum effect on other services as well. As you treat more patients, you need more folks in food services, environmental services, support services. And so while directly the number may not be impressive, the ripple effects in our ability to maintain and grow our workforce is significant.
Yeah. And the second part of your question, you asked how we would sustain it. As I alluded to, we see this as a business opportunity for us, that endoscopy is something that it is one of the procedures that we get reimbursed for. We can't say that for all the things that we do as a healthcare provider, but we do get reimbursed for doing endoscopy. And so the finances work out that as we grow this program, it does help us not only sustain endoscopy, but it helps us to sustain the rest of the organization and the things that don't generate any revenue.
Got to have good billers. Thank you. Thank you for presentation. Thank you, Madam Chair.
Thank you. Just one last question about the construction. So will this 1.7 complete the project that you're going for, or will you need more money to complete the project?
The hospital is ready to contribute to that as well. The 1.7 would certainly cover the bulk of it, but we anticipated that the overall cost of the project would be a little bit north of that.
Okay, thank you very much. Appreciate your time today and appreciate your
Thank you very
patience
much.
in waiting.
Appreciate yours.
Thank you.
Thank you.
Thank you so much. Highland Hospital is one of only 4 independent hospitals left in the state. We just lost another one like 3 years ago, so it's just an amazing help to our community. Thank you so much.
Thank you so much for being
Thank you.
here and for your patience. Okay, Rep. Tisdal, you're up with the City of Rochester.
Thank you, Chair and Committee. Best for last, right? This will be less than 40 minutes.
Thank you. You're
So anyway, it's this is to expand and renovate the community house in the city of Rochester, and it truly is the center of the community. We originally were awarded a grant back in October of 2024, and it just seems like it's very frustrating. It seems like we've been on a budgetary treadmill ever since then, and while the goalpost keeps getting changed as well. And with the redesigns, the resizing to keep change with the budgetary needs, getting Planning Commission approval, City Council approval, it just seems like we've never been able to catch up. I've got Jason Warner with us here this afternoon. He's the Director of Project Management. And Jason, take it away.
Thank you. And thank you for having me. So yeah, the Community House in Rochester is a city-owned facility and is run by a nonprofit. It's one of the most widely used facilities for nonprofit organizations and other groups in the Rochester area. And our project is to expand and update the facility, which dates to 1975. The project has been bid once this past summer. Bids came in higher than expected. And we have recently resized the project, and it's gone through our planning commission for site plan approval, and we're ready to rebid it. We think we're in good position to have a viable project, and we are eager to continue the process, and I would be happy to answer any questions.
All right, any questions from the members? Well, I just, so is this a renovation of a current facility that you said it was built in 1972 or in the 70s? Or is it a new
Correct, yes.
construction? It's not new construction.
It's adding a little bit of space, so it's an addition to the building and
okay.
renovation of about 50% of the original building.
Okay, very good. And have you sought other funds or other grants or anything for this project?
We haven't received any other grants for the project. The city has a bond issue to cover some of the other additional costs that we may have on the project. So we do have funding sources available.
Okay, thank you. Rep. Robinson has a question.
Thank you. I see that I'm ashamed because I live near Rochester. I've never been here, so I'm going to have to check it out. But you talk about having classes for fitness, kids cooking, and sewing. Could you talk a little bit about what you do there? Is that like community outreach, or what do you guys do there?
Yeah, so the nonprofits, educational organizations, they can rent space at the facility. That's kind of how the nonprofit generates their funding, is from either donations or facility rentals to hold those events. So they can, the groups can rent space within the building and hold their classes, whether it's educational or exercise or other types of meetings or gatherings.
And if I could jump in, there are 27 different service groups that use the building, Rotarians, you name it, teaching everything from CPR to stop the bleed to boating safety. I took my kids there probably 30 years ago now. And, you know, and one of the coolest things is they have a certified commercial kitchen that allows entrepreneurs to test pilot their food business ideas. And so it's running 7 days a week, round the clock.
Thank you. Thank you, Madam Chair.
That's great. Well, thank you so much. I appreciate you coming in today Appreciate your patience and waiting, and thank you so much.
Thank you.
Yeah, thank you.
All right, there being no further business before the committee, we are adjourned.